So, welcome to the Holistic Cat Specialist YouTube channel. I am your host, Paola Zanibelli Davis, and today I am excited to welcome a very special guest who brings great expertise in holistic feline health. Dr. Lisa Fiorenza is a Cornell-trained holistic veterinarian with an impressive range of certifications, including Chinese veterinary acupuncture, food therapy, Western herbal medicine, and fear-free pet handling. As the founder of Dragonfly Holistic Veterinary Care, she specializes in integrative approaches, including acupuncture, Chinese and Western herbal medicine, ozone therapy, and microbiome therapy. Dr. Lisa shares her home with two cats, Flip, who is 9 months old, and Nico, who is 12 years old, as well as two dogs, Amelia and Jake. One topic that she is particularly passionate about is feline infectious peritonitis, or FIP, which is especially relevant for our cat-loving audience, of course. So, Dr. Lisa, thank you so much for joining us today.
Thank you so much for having me. I love how you say my name. It's not often that I get that it's so beautifully enunciated.
It must be the Italian
Yeah.
background and heritage. Yes, I have the same effect when they pronounce my name in the most different ways because apparently my name Paola is not very easy to pronounce
Mm.
in the English and yeah, language. So right, so we are talking about FIP today. So I help cat parents support their cats with their most diverse conditions and issues and diagnoses at different stages in their health journey. But one condition that I am really eager to outsource expertise for is FIP. So this is because there is a legal side to sourcing the necessary drugs and that I feel is better handled by someone who specializes in this disease and like Dr. Lisa here. So FIP has historically been considered a fatal disease, but recent developments have changed that narrative, fortunately. And I'm sure many parents are very thankful about that. And I would like to explore what this actually means for cat parents today. So let's dive right in. And what is FIP and how is it treated?
So FIP is feline infectious peritonitis. It is a coronavirus of cats, so it's one that's not contagious to people. It's interesting in that it has a lot of overlap with COVID in the fact that it can be very mild for the vast majority of cats, and it can be very serious in a small population of cats. But it is actually an unrelated coronavirus from a different part of the coronavirus family tree. As you said, it has always been a fatal diagnosis until the past roughly 6 years or so now. So UC Davis, Dr. Niels Peterson out there in, I believe it was about 2016, started to make some really big breakthroughs in FIP research. They'd been looking for a cure for a long time. And they came across the compound GS, which is basically just the chemical compound. There's a dash and a whole bunch of numbers afterwards, but we call it GS for the most part. It's a sister drug to remdesivir, which is used in coronavirus COVID treatment. But it works phenomenally for these cats. In, I believe, 2018, the first paper was published showing how well these cats were responding to treatment. And in around 2019, this incredible black market developed around the drug because we couldn't find any way to get the treatment into the hands of pet owners or veterinarians. And this worldwide network grew where there were people making the medication and then getting it to an underground railroad that would get it out to the cat parents. And it happened, without the help of the veterinarians because we had no legal way to touch the drug. And, whenever new research is coming out, unfortunately, it does take a long time. It's on average about 10 years for those things to actually show up in practice. So we're almost, we're getting close to that point, but it seems like we're going to probably get there before the 10-year mark, I guess, depending on when you start counting. But as of, I believe in the UK, it was maybe 3 years ago now that you guys had more legal access to it. However, in the US, we've only had legal access to the drug since last June of 2024. So
Wow, that's
yeah, I mean, it's brand new.
recently.
So
Yes,
since around March of 2020, I started helping patients, pet parents and the patients through diagnosis, treatment, aftercare, monitoring. I couldn't dispense the medication. I couldn't prescribe the medication until just under a year ago. But I could help with figuring out what it was because one problem is that it's just such a difficult disease to diagnose sometimes. And I would say oftentimes, most of the time, what we've
yeah,
learned in vet school of it being, the classic symptoms aren't necessarily always there.
it can be very elusive.
Very, very, very. So yeah, it's been quite the road. I've treated and cured. It's got to be somewhere between 60 and 70 cats over the past 5 years. And it's been incredibly rewarding because so many of them are kittens too. It's often a kitten disease. So to see them and to give them a death sentence is always heart-wrenching. It's not typically very commonly seen. I see a lot of it because it's what I do.
Of course.
But, it's something that prior to then, I probably saw maybe one case a year or possibly even less than that until I really started to look for it and it, they just kind of funneled to me after that point.
Yes, yes, there are groups around that have a big conglomeration of cat parents that are all affected by this disease, and the difficulty lies also as what you said, because it's such an elusive disease, and yes, it's most common in kittens, but we have seen it in more adult cats, and sometimes
Hmm.
the symptoms
Absolutely.
are easy to misdiagnose and
Hmm.
also easy to you can think it's something else, but maybe it is this and maybe it is not, and before you obviously go with a heavy protocol of drugs, you would like to be sure, and it's difficult to diagnose this disease for certain, so it is difficult to treat, but once you observe the symptoms and you're pretty sure that this is what it is, then thank goodness now we have this drug that helps,
Yes.
making this disease not a fatal one anymore, in many
Right.
many cases. So from your clinical experience, actually, what are the early warning signs of FIP that most parents miss, and how the earlier diagnose and sorry the early detection, we should say, is not maybe yet a diagnose, but detecting these things early, how does that change treatment outcomes?
So the only issue here is that they do tend to be very nonspecific. It's usually decreased energy, decreased appetite, hiding or decreased like socialization. They don't want to be with their people as much. Um, and then potentially weight loss. So that can be any number of different things. But if you do start noticing that, then general blood work is often really helpful at looking for some of the other changes that can be present. The other thing is on exam, they'll oftentimes have a fever. So if you have an inkling that this could be a possible cause and you have some resources as to, what to help your vet with, or if you're really lucky and you have an FIP savvy vet, then you can potentially get an earlier diagnosis as opposed to waiting until they're really sick, and they may be having trouble breathing, or they could have neurologic symptoms like difficulty walking or pain or seizures. Then yes, the sooner we treat it, the better for sure. I have seen many that have been pretty far along in the disease process, and we're still usually able to get them back, but the earlier you treat it, the better, always.
Of course,
Um,
like, yes,
yeah,
with everything,
with
the earlier
everything.
you catch it,
Absolutely.
the
Yes,
earlier you catch it, the
for
better.
sure.
Yeah. Well, I teach hands-on cat care, and when they're hit with a heavy diagnosis like FIP, cat parents wanting to save their cat, or at least give their cat a good chance at survival, they need to be pretty hands-on and definitely quite resilient, I would say. So there are practices that they need to put in place and routines that they have to observe that can be quite challenging on an emotional level and practical level, I would say.
Mm.
So what are these practices? What can you say about this? And how do you guide them so that they comply with what needs to be done to carry out the FIP treatment?
Mhm. So it is easier than it was, thankfully, now that we have the legal access to the drugs. And I mean, it's not legal. There's no legal access worldwide, but in many countries there are. So for those where it's not legal, if you have access through some of the groups, you can get it, but you might be dealing with the injectable version, which is definitely going to be a little bit more intensive. So now with the oral version that's legally available, the giving it is much easier than it was. The injection, when that was all that we had, was pretty painful.
Mm.
So, and you'd have to do it at least once a day, and in some cases twice a day. And it was not only painful, but the reason it was painful is because it was damaging to the tissues. It was just chemically, it didn't really vibe well with your skin, basically. So it could cause a lot of pain, and it could actually cause pretty bad sores too. So that was one of the big things we would see with it. So we would have to treat for pain. They'd have to be on a pain medicine daily so that they could have a little more comfort when they got the injections. And then if they developed sores, we'd have to deal with that as well. Now with the oral version, we really don't have to deal with any of that. There are some rules for how to give the medicine. You do need to fast for 45 minutes before and after. So I tell people, make sure you're not leaving food down overnight. Give it when you wake up in the morning and then wait 45 minutes before you put their food down. I usually tell them an hour just to be on the safe side, but we do want to make sure that that is happening because that's how it's best absorbed and that's how it's going to work best. I mean, that's probably the biggest one. There's always a little bit of learning curve with how to give oral medicine. Thankfully, again, at least in the US, we have a bunch of different forms available. So it's in tablet, it's in liquid, it's in chewable treat. So some of them are easier than others. And, I just say whichever one works for, for you and your cat. Some pet parents know what's easiest. Some are just like, let's just do the treat because that's probably easiest. I always kind of tend to go towards liquids, but it depends. Some are easier with pills. And then depending on the form of FIP that they have, you're either going to be treating once or twice daily, which just, twice daily is a little harder with the whole fasting piece. And you do have to be pretty on time with the medicine. You only have about a half hour to at most an hour of wiggle room on either side. Otherwise, we can run into some issues with especially earlier in the disease. It's probably not as big of a deal later into treatment. But earlier on, you have to be pretty on time with their
Mhm.
medicine. The other thing is just the length of the course of medicine. It is three
Yes.
months of treatment, so it's pretty lengthy. We think that at least for some forms, the easier forms to treat, that might be cut down, possibly cut in half. So there are ongoing studies about that are pretty encouraging. But the more difficult forms, like the neurologic form, at least at this point, are going to stay at that 3 month treatment time, and then we actually want to monitor them for 3 months afterwards. So it's a 6 month process, and throughout that time, you do want to keep stress low because stress is a huge trigger for this disease.
Yes.
which is yeah, so that's a big thing, and that's another thing for pet parents to look out for, because stressors followed by, weeks to a couple months later, your cat suddenly seeming not themselves and declining in, their health, is a very common scenario for these guys. So with kittens, adoption, vaccines, spay neuter. With older cats, new cat in the house, a move, or any
Okay.
other kind of stressor can trigger the disease. And sometimes they will have like mild cold symptoms or mild stomach upset symptoms within a week or two of the stressor, because that's what the normal form of this virus causes, is essentially a cold or stomach upset. But then in some populations, in some cats, it'll mutate into the very dangerous form.
Yes, I think a lot of the cats that are rescued have coronavirus in their system, and that's not necessarily a reason for concern as it is. The
Right.
reason of concern is when it mutates. So
Mhm.
always keeping stress low is always important because there is always a chance for the virus mutating into FIP, into the more dangerous form, which is FIP. And yeah, the symptoms that you described before are very non-specific. And
Mhm.
I mean, how many times a cat can feel a little bit off and is just a matter of a couple of days and then they're fine again and it's just something temporary and you have to be really observant with your cat and really see if there's something more going on and it's something that is persistent because that would prompt obviously more investigation and obviously finding out if there is anything like this going on. So, based on your cases, how does nutritional support? I know that you're passionate about natural nutrition and species appropriate nutrition, and so am I. So, how does nutritional support and complementary holistic care enhance the efficacy of conventional FAP treatments?
Mhm. So usually in the beginning stages, especially if they're super sick, it kind of goes out the window and it's just get them to eat. I don't care what they're eating, just make them eat. So we'll kind of take a back seat for a little bit because sometimes they're so sick and they don't want to eat anything and they just need calories.
Yes.
So whether we're giving them some, meat and sardines and whatever kind of, table scraps kind of things, or the junky canned food or whatever. We'll kind of say we'll deal with it later. We've got to get through this critical period. Once they start to feel better, and I think, with this population, I get a mix of people. I don't have necessarily a strongly holistic leaning
Mhm.
um, group of people coming to me for this. These people are oftentimes more on the conventional side of medicine, and they just are really looking to treat their cat. But some of them also have other issues. I have some who have inflammatory bowel disease at the same time. And if you don't get that under control, you're going to have a harder time clearing the virus, because if the body is also sick from something else, that's a stressor right there.
Mhm.
So, if they are willing to move on to fresh foods once we're out of that period where they're once they're feeling happier and they're eating well again, then we can kind of make that move. And we take it slowly. I don't like to make big changes with these guys because, again, stress.
Stress.
So, cats,
Yes.
they just don't like stress. I don't blame them. Um, but and then in some cases, again, a lot of the time I'm treating these any secondary issues with herbs and supplements. They're frequently anemic, meaning their red blood cell levels are low, or their liver might be kind of sluggish. Some of their liver values can be a bit high. So, well, depending on what the pet owners want to do, I mean, oftentimes treating the FIP will clear that. But I'm of the mindset that helping the body to get through that is certainly not going to hurt as long as it's not increasing our stress level to give more supplements.
Yes.
Um,
Yes, and there are
yeah,
lots of things that help with that in
exactly.
Chinese medicine, for example, to
Yeah,
help the
for sure.
flow of qi and to help the body get rid of
Yes.
toxins, etc.
Yes.
So,
So a lot of times I am trying to just modulate, so which the immune system response, which basically means you don't want an extremely overreactive immune response, but you also want to boost the immune system function. So it's kind of like a middle ground. So I'm trying to modulate that immune system response to the coronavirus that's causing the issue. There are also herbs that are going to herbs that have anti-coronavirus action. So I'll sometimes throw those in. A lot of the time, I'm adding in stress support. I'm adding in gut support because the gut is the root of pretty much everything, which is where the food
yes.
comes in. Yeah. So, and then if I need it, I'll kind of see what else the individual needs, whether it is the red blood cell support or the liver support or something else.
Yes, that makes sense. And yes, I'm totally with you on that one, where you want to first of all address the closest crocodile to the canoe, as we say, and take
Yes.
care of the urgent stuff first and settle this first, and then as soon as they are able, the parents and also the cats, they're able to deal with more and to
Right.
address other things, then you can then support them with other ways that are always supportive of the whole body system. So I would agree 100%
Yeah.
with what you say. And in terms of post recovery complications or long term effects, have you observed in your FIP survivor patient any of those? And how do you recommend that parents monitor their cats after the treatment?
So, I mean, the good news is that most of these guys will make a complete recovery and they'll be normal. There are, a few caveats. Most commonly, it's the neurologic form. I sometimes see a little bit of lingering nerve damage with the neurologic form, especially if it's more in the spine. So we kind of just watch. Usually they get significantly better. And then I always tell people they might not be 100% with cure. So, because it can just really do a number on the nerves, and nerves are not great at regenerating,
Yes.
there can be some lingering effects. So they might be a little wobbly, or, they might have a little trouble jumping. They might not be your typical little ninja cat. They might be a little
Yes.
more clumsy. But the big thing that we saw with the injectable was, like I said, sores and rarely injection site tumors, because that can happen with all injections
All
in
injections.
cats. Yeah.
Yes.
So again, I mean, really happy that we have the oral form. In some cases, you still need to do the injectable, at least initially. In particular, cats that have severe GI disease, whether it's FIP as the cause or other, unrelated GI disease, that just can't absorb the drug, we'll start with the injectable form. Or if they're so sick that they can't swallow the oral medicine, we'll start with the injectable form. So those are kind of the big two populations that we still need it. But most cats are fine with just the oral form, and then you avoid the issue of the injection site pain and all the other secondary effects. When we were using the black market drugs, we were also seeing rarely bladder stones, but we also think that was probably just because the concentration of the black market drugs were unreliable. Some of them were actually way higher than they said, and that was where we ran into some issues with seeing some increases in kidney values and bladder stone formation. So I think we're probably going to see that just go away with having switched to the oral version.
Right. And when the injections are involved, um, how do you manage cat parents to be compliant? Is it the fear that this is actually a deadly disease that will take their cats from them that makes them do what they don't want to do? Because I bet nobody wants to hurt
Yeah.
their cats
Yeah,
and
no.
give them injections. And there are ways that I deal with other conditions that it requires sometimes injections
Mhm.
or giving fluids or and nobody wants to run after the cat, or
Yeah.
they complain. Sometimes cat parents complain that cats will hide from them
Hmm.
because they expect them to come with the injection, or because it becomes a regular thing that they need
Yeah.
to do for a while at least. And obviously, my approach to that is that you have to go a step back. And if there are places in your house where your cat actually runs and hides and cannot be retrieved, you actually need to stop those places from being available, because
Yeah.
you can build a relationship even upon this sort of medical care that you provide at home, but you also have to push that challenge line a little bit so that your cat is available. You can carry this out properly. You can praise afterwards. You can
Hmm.
make it a bit of a ritual. You can make it as painless as possible, but you also have to be able to carry this out, because otherwise
Yeah.
you are not controlling the environment enough for the treatment to be carried out and to be successful eventually. So I think, what is your opinion on this particular
Yeah.
facets
So
of?
right. I agree with pretty much everything that you said. I don't like to use it as a scare tactic, but yes, they have to know that if they can't get the medicine in, that their cat is at risk of dying. There's not really a way around that. It's the
Mm,
truth. I can't sugarcoat it because if you don't understand it, then that's on me if you're not trying hard enough. The I mean, I guess the silver lining is that oftentimes for the first couple of weeks, while the cat parents are trying to figure out how to do all of this, the cat is usually so sick that they're just like, I don't care what you're doing to me, like just it's whatever.
mhm.
They actually respond incredibly quickly. So my little man Flip that you introduced, he is an FIP kitty. We are
Yes.
2.5 months into the monitoring period, so we're almost there. We've got a couple weeks left till we can call him officially cured. But he was, I was amazed when I saw how quickly he responded to the medication. We adopted him knowing he had FIP and he was already on the injectable, but he was not being dosed appropriately. And actually, that's another important thing to bring up, especially because these are often kittens. If you're not changing their dose as they gain weight, but even with adults, because they're usually gaining some weight back, you're going to underdose them and you're going to cause a relapse. So you do have to be weighing them. I recommend usually at least twice a week, and
Yes.
then working with your vet or your admin or whoever to make sure you're increasing the dose as you go, because that's exactly what happened with him. He was relapsing when we picked him up, and he had a fever. He was quiet. He didn't really want to play. And we were like, all right, I mean, it's the first time we're meeting him. We don't really know. But as soon as I felt that he was hot, I was like, he's relapsing. Like, luckily, mom knew what she was doing here. But so we double dosed him for a few days. And literally, after one dose at home of the more appropriate dose, I could already feel his fever breaking, and he was more interested in food and a little more energetic. Like one dose. We're talking two
Wow.
hours. It was
Wow.
mind-boggling.
Mhm.
And then, after a week, he was like a new cat. So he had so much more energy, and then it just improved. And he's like a crazy little normal ninja kitten at this point. So very important to be weighing them. But as far as your question, the other big thing I usually recommend, or at least I used to more so when it was the injectable. I don't usually need it now. I'm sure you're familiar with them, all the cat wraps that they have. There's one that's called, I think it's Common Cozy Cat Wrap. That was one of my favorites because it just, you basically you put your cat in a bag, you zip them up, and then you wrap them, and then they have all these little flaps that you can open. And it gives you an access to space to inject them. So it was phenomenal for cats that wouldn't let you do the injections otherwise. And you can use them for other injectable medicines or for fluids. I use them a lot for cats for nail trims who are like, little
Wild.
panthers.
Yes.
Because it's a bit calming for them to be in a swaddle, but it also, you're safe from the nails and you have access to the important bits. So I think it's just a little bit more comfortable for them than other kinds of restraint. I think it's easier for pet owners at home. But I do, praise and treats afterwards with the injectable form. Can't do as many. We would do like a treat after Flip's oral medicine, but for the most part, we need an empty stomach.
Yeah.
Um, so yeah, I would say those were kind of my go-tos. I loved the wrap and most of my, I mean, the pet owners who were coming to me have always been dedicated. Like they're finding me because they need some help for their cat and they've
Hmm.
been to one or more vets already. And they do a phenomenal job. I've been super proud of all of them.
Yes, and in fact, on this note, I would like to end with a question that involves pinpointing the qualities that actually these cat parents must have to carry
Mm,
out not only this treatment, but also those treatment that are long term. And sometimes, obviously, health is not a switch, and especially that you just flip to good as soon as you introduce something. And especially when we're talking about natural remedies, sometimes things take a little while to work because the
mhm,
body needs to be able to receive those gentle nudges and slowly change and slowly get supported. And then eventually, 2 months down the line, you will see results. But at first, you need to be patient. So, my question would be to you: what qualities do cat parents need to have to succeed in this long term effort to treat their cats, in this case with FIP or with generally long term sort of treatments and therapies? Um, so like significant health conditions, for example, or challenges. And what do you think, in your opinion, what are these
Um,
qualities?
I mean, I think dedication for sure. Patience is a big one. And then I think sometimes you need to just step back and take a breath and, because it's hard. You have other things going on. You don't just have a sick cat. You might have, a business or kids or a sick other family member or, your own struggles. So it's, we're adding to whatever else is going on in your life. But it's doable, you need to just take a breath, figure it out. And I've always helped my pet owners with that because again, they are, they're phenomenal cat parents. So you just need a little hand holding sometimes.
Yes, you I think you need to be resilient because
Yeah, resilience is a great one.
you have to sort of sometimes do things that are a little bit um, they make you
A little
wince
scary.
a little bit, yes. And it's like the first time when I coach people about putting fluids into their cats, etc., and I have training and everything else, and then eventually it comes the moment when they have to put the needle inside their cat, and they all tell me, oh my goodness, I was so scared to hurt my cat and I didn't quite know if I was doing it right, but I watched the video again, etc. And then
Hmm.
eventually they do it once and they said, actually, it wasn't so bad. I actually, my
Hmm.
cat didn't complain so much and I could carry this out, etc., etc. So, and
Yeah.
I always have alternatives in terms of I like finding different options. When one doesn't work, I always find for something different. So yes, in some cases you can't give a treat. One, because sometimes cats are really sick and they don't really want to treat. They don't,
Mm.
is not really something that will interest them at that stage, or because in this case you need an empty stomach, so you can't really indulge them too much in that way. But you can offer a little bit of catnip. You can offer them a smell that they like. I have a valerian tincture that they
Hmm.
absolutely love, and is natural valerian, and I can put it on my hands, and
Hmm.
they will lick my hands and they will be so happy afterwards because it's very relaxing. So,
Yeah.
there are so many ways there are games that you can play with cats that are happy enough to play. And, so there are so many different ways that you can
Hmm.
help your cat get a reward after these experiences. So, but yes, this has been such a great conversation. And for our viewers here who want to learn more about your approach or maybe work with you even, could you tell them where they can find you online?
Yeah, sure. So I am on Facebook. It's facebook.com/dogtour Lisa, DOGTORLISA, and on Instagram at Dr. Lisa Holistic Vet, all one word, no other characters in there. I believe both of them should have my website, which has some free resources. Some, I think, really good ones for you guys. I do have a free resource on FIP that is pretty in depth enough to kind of help your vets as well if they don't, if they're not comfortable. But also gives you lots of things that you can kind of look out for and help you to advocate for your cat. I believe I also have a list of things you can mix herb supplements and medications with to help get them into your kitty. I'm sure you have plenty of that too, Paula.
Yes.
Um, yeah, so I have those two resources for you guys. I can do virtual, with pretty much anywhere. Depending on where you are, U.S. and Canada, I have access to all of my herbs and supplements that I can send you. Outside of North America, it's a little trickier. I can't really. Um, there's trouble getting them into the EU and elsewhere, but I can make recommendations, and I can, for FIP, I can't really prescribe the medications, but I can definitely help to decide what testing is, maybe recommended. How likely is it that this is FIP? Should we do a treatment trial? How to dose, how to get through treatment, what the follow-up bloods are looking like, how we're responding, all that stuff. So I can do tons of support virtually without
Yes.
having to be the one prescribing.
Yes, there is a lot of support that we can definitely provide virtually, and it's incredible what you can do online. And I source links everywhere, and especially in the US and the UK, I know the companies, the supplements, and so you must do the same with your,
Mhm.
obviously, with your expertise about FIP in particular. So yes, and Dr. Lisa offers, as she mentioned, telemedicine consultations for holistic and herbal medicine, and as well as FIP diagnosis, of course, and treatment recommendations. And as she mentioned, she has beautiful free resources that are available for all our cat parents. So I will include all the links to Dr. Lisa's website and social media accounts in the video description below. And Dr. Lisa, thank you so much for sharing your knowledge and expertise with us today. The work you're doing is definitely making a difference in the lives
Thank
of
you.
cats and their humans, particularly those who are affected by FIP.
Thank you
Thank
very
you very
much.
much.
Thank you for having me.
And to our viewers, if you found this information valuable, please like this video, subscribe to the Holistic Cat Specialist YouTube channel, and hit the notification bell to stay updated on future content. I will see you next time. And until then, love your cats as much as you can. Bye for now.
Bye.